So today we'll be discussing about serological and immunological tests. First off, we'll start off with serological tests when we test serum. Okay. Now there are four main types of serological tests. They can be uh, precipitation test, agglutination test, or agglutination reaction भी बोलते हैं उसको. All of these are also called precipitation reaction या agglutination reaction. Okay, test or reaction. Then you have neutralization reaction. Finally, complement fixation. Complement fixation test. Okay, so what are these? Now, first of all, coming to precipitation tests, whenever you have a soluble antigen, okay, antigen that is present inside a suspension, okay, what you do is you carefully layer it over an anti-serum into antibody solution. Okay, what will happen is precipitation occurs as soon as these two media come into contact. Whenever you add antibody, or well, let's suppose you are adding an antigen to an antibody. Okay, you have a soluble antigen and you are adding that antigen in a suspension, and you are adding that layering that over a specific anti-serum. That anti-serum contains antibody. Precipitation will occur. Similarly, let's suppose you have an anti-serum which is already present in a semi-solid medium. For example, you are putting antibodies on agar gel. ठीक है. If you remember ELISA, indirect ELISA and direct ELISA में जो sandwich ELISA करते हैं and डायरेक्ट एलिसा करते, आप एक में क्या करते, यू विल टेक अगार जेल, यू विल पुट एंटीबॉडीज ऑन टू दैट. ठीक है, एंड ऑन टॉप ऑफ दैट यू विल पुट एंटीजेंस. ठीक है, you can test this way as well. So in this case, whenever you want precipitation to occur, you take a little bit of agar, you add antibodies to it, you'll add antiserum to it. That antiserum will contain antibodies. ठीक है, that antibodies, whenever you pour a little bit of hey guys, sorry about that, I got disconnected for some reason. Right. So as I was telling you, the second way of doing it is you take a tray of agar. Okay. You take a petri dish, and in that you put a little bit of agar gel. Let's suppose you are putting agar gel like this. Okay. On this agar gel, what you do is you will add anti-serum. So you have antibodies, anti-serum which is containing antibodies attached to it. ठीक है, ऐसे antibodies है suppose. Now onto this, what you do is you will add antigen. यहाँ पर क्या टेस्ट कर रहे हैं आप, वेदर और नॉट दिस पर्टिकुलर एंटीजन इज प्रेजेंट और नॉट. ठीक है, फॉर एग्जांपल लेट्स सपोज आप हीमोलाइटिक स्ट्रेप्टोकोकाई के लिए मेजर कर रहे हैं. ठीक है, द समथिंग कॉल्ड इलेक्स टेस्ट. okay, you test for specificity of beta hemolytic streptococci. So what you do is you will take streptococci antigen, and whether you want to find out that particular strain of bacteria is present or not, आप क्या करते, already known antibodies against those streptococci already know that this particular patient might have बीटा स्ट्रेप्टोकोकाई. तो मैं क्या करता हूँ, उनके अंदर से थोड़ा सा सीरम लेके आई विल अटैच दैट सीरम. सो बिकॉज दैट सीरम, द पेशेंट सीरम विल हैव एंटीबॉडीज. ठीक है, इफ आई वांट टू फाइंड whether or not the patient has streptococcal infection, what I will do is I will take a little bit of agar, I will put anti-serum onto that, the patient's anti-serum on the agar gel, and I will add an antigen that I know will react with beta streptococci. ठीक है, so if let's suppose this is the antigen, ठीक है, let's suppose these are the antigens. What will happen if it is beta streptococci, these two will attach and there will be precipitation. अगर beta streptococci नहीं है, you already know antigen and antibody reactions are very specific. Only one particular type of antigen will attach to specific type of antibody. It will not attach to any other antibody. The same way, what will happen is if beta streptococci is present in the patient, the precipitation reaction will occur. That too, you will see different bands on the agar gel. अगर बीटा स्ट्रेप्टोकोकाई नहीं है, कोई और बैक्टीरिया है, then this antigen will not be able to attach. Hence, it will help in diagnosis. ठीक है, that is one way. Alternatively, आप वैसा भी कर सकते हैं, wherein you are taking, you're taking antigens and you're adding antibodies to it. That will also work. This is also another way. Then we have something called agglutination test. Okay. Now agglutination test में क्या कर रहे हैं आप? See, antigen is a particulate matter. It will clump when you are adding it to specific anti-serum. ठीक है? Whenever you add one particular antibody and antigen, I'll tell you the difference between agglutination and test and precipitation test, because it can be kind of confusing. What is precipitation and what is clumping? ठीक है? दोनों में थोड़ा डिफरेंस रहता है, एक में एंटीजन सॉल्युबल रहता है, एक में एंटीजन इनसॉल्युबल रहता. So what ends up happening is, in precipitation antigen is soluble, because of which an insoluble insoluble precipitate is formed. Agglutination में जो एंटीजन है आपका, that is insoluble initially. Whenever it clumps with whenever it combines with antibody, it will clump. ठीक है? So that will be the main difference. दोनों भी you'll be able to see with naked eye. You will see clump being formed or you will see precipitate being formed. But in agglutination tests, what will happen is, you will see that once clumps are being formed, they will deposit down and you'll be able to see supernatant on the top. ठीक है? You'll see a clear solution on the top. Now, if you are doing a serial dilution of antiserum, let's suppose you are diluting antiserum and a constant volume of antigen is maintained, you will be able to quantify the amount of antigens or antibodies that are attaching. ठीक है? अगर आप जो सीरम है उसको डाइल्यूट करें, so what you will be able to do is that once you add the insoluble antigen, you will be able to quantify exactly how many amount of antigens or antibodies are present inside that antiserum. ठीक है? Sometimes what will happen is soluble antigen or soluble antibody is made insoluble by coating it with latex, and you will be able to with some particular desired antigen you will coat it, एंटीजन और एंटीबॉडी. अगर इनिशियली एंटीबॉडीज को कोट करें आप लेटेक्स से, तो अगर एंटीजन को कोट करें लेटेक्स से, देन लेट्स सपोज एंटीजन इज कोटेड विथ लेटेक्स, यू विल ऐड एन एंटीबॉडी. ठीक है? अगर एंटीबॉडी को कोट करें लेटेक्स से, एंटीजन ऐड कर दे. ठीक है? what ends up happening is, if it is that specific type of antigen or antibody, मतलब ये एंटीजन को स्पेसिफिक एंटीबॉडी है बोले तो क्लंपिंग होती. अगर नॉन स्पेसिफिक है बोले तो देयर विल बी नो क्लंपिंग, दे विल नॉट अटैच टू ईच अदर. Okay, similarly if you have an antibody which is surrounded by latex and you add specific antigen, clumping will occur. If there is no specific antigen, clumping will not occur. Okay, so now what is the difference between agglutination and precipitation? Now you might be getting confused, what is this? See, this is the basic difference. अगर आप माइक्रोस्कोपिक लेवल पे देखें, clumps जो फॉर्म होते हैं, they'll be like this. ठीक है? There'll be a direct antigen antibody vertical reaction like this. They will clump together and form small how should I, pouches जैसा form कर दे. Okay, there'll literally be small clumps. You'll be able to see once if you perform a test tube के अंदर. ठीक है? You'll be seeing several clumps like this. Whereas precipitation में what happens is, you take a suspension. Initially you take a solution and you already have what do you call, let's suppose in this case you have antigens in it. In that you add antibody. ठीक है? anti-sera आप add कर रहे हैं. Immediately suspension will be formed and that suspension will start precipitating. प्रेसिपिटेट विच इज फॉर्म्ड, अगर स्पेसिफिक है एंटीजन एंटीबॉडी, अगर स्पेसिफिक है तो प्रेसिपिटेट फॉर्म होता है एंड दैट प्रेसिपिटेट विल गो डाउन. ठीक है? एंड यू विल क्लियरली हैव सुपरनेटेंट ऑन द टॉप, which you can it will be a clear liquid on the top. That is the main difference between precipitation and clumping. ठीक है? or agglutination. In agglutination you will have clumps being formed. All right, फिजिकल स्ट्रक्चर अलग रहता दोनों का. Then we have neutralization reaction. Neutralization reaction is done when you are, let's suppose you are testing for a bacteria which you know is very toxic. For example, let's suppose you are testing for detection of the toxicity or toxinogenicity of diphtheria bacillus का toxicity आप measure कर रहे हैं, how toxic that is to a patient's body. You are testing that in a guinea pig. For example, you take a guinea pig, ठीक है, clinical experiment में you take a guinea pig and you are trying to test how toxic one particular bacteria is. So in this case, let's suppose you are taking diphtheria bacteria, ठीक है. Whenever you add diphtheria to that particular guinea pig, you will add a little bit of antitoxin, okay. That antitoxin will directly neutralize the effect of the toxin. It will neutralize the effect of diphtheria bacteria. Now depending on how potent that toxin is, आपको उतना ही antitoxin use करना पड़ेगा, okay. It can also be used to detect antibodies if known antigens are used, okay. So what you are doing is, if a bacterium or its toxin, which you know is lethal for a laboratory animal, especially when there is coexistence of antibody or antitoxin, what you need to do is you add that antibody, you add antibody या antitoxin against that toxic bacteria, ठीक है. This is done so that the lab का जो आपका guinea pig है or the animal on which you are testing, that fellow does not die, ठीक है. That is neutralization reaction. All right. Then lastly, we have complement fixation. Now complement fixation, I'll show you in video. It is easier to explain using a video. देखो, अब आप क्या कर रहे हैं कॉम्प्लीमेंट फिक्सेशन में. सी, you take two measuring glasses, and in that what you do is you add a little bit of solution, and in one of them, so there are two patients, ठीक है. सो पेशेंट ए एंड पेशेंट बी है. एक पेशेंट में एंटीबॉडीज है, ठीक है, पेशेंट बी में एंटीबॉडीज नहीं है. Okay, the first patient A has antibodies, patient B does not have any antibodies in them. Complement is complements are proteins, okay. Complement proteins are specific type of proteins that play an important role in immunity. All right, what they will do is essentially आपके immune system में आता है, आप लोगों को पोर्शन में नहीं था, but complement proteins, they will make a one particular complex and they will tear open the pathogen. That is the function of complement proteins, okay. They will help in immunity, just remember that way, okay. So what you are doing, you're taking two beakers and you are testing for specific antibodies in the patient's serum. See, the patient will differ in the amount of complement proteins that are present in their body. So initially what you do is you heat the solution so as to remove all the complement proteins which are present in the patient's body. अब आप क्या कर रहे हैं, patient का थोड़ा antibodies ले रहे हैं. You take a little bit of blood from the patient's body, you isolate their serum, and in that serum there will be antibodies and complement proteins. Here you are trying to find out how well that complement is fixing to that antibody, ठीक है. Whenever antibody and complex complement reaction occurs, that will go and attach to the antigens of a pathogen and it will help in killing the pathogen, ठीक है. Now if you guys are having doubts, please feel free to ask, because this stuff can get a little confusing, any of these tests, okay. So what you do is, अब आप standard complement जितना जिसका कितना fix हो रहा, okay, how much amount of complement protein or how well that complement protein is attaching to the antibody, you are trying to test that complement fixation test. You are trying to assess how well a complement protein is fixing to one particular antibody or the antibodies in the patient's body. So you take two beakers, one is the test beaker, one is the control beaker, ठीक है. एक beaker में आप क्या कर रहे हैं, you have antibodies, okay, those Y-shaped structures are antibodies on the left of patient A, and patient B में you do not have any antibodies, you only have antigens, ठीक है. You will heat the solution so that any complement proteins that are present inside the jar or in the antiserum, that is killed, or those are destroyed. That is the first process, okay. See, you heat the serum to destroy the patient's complement proteins, okay. Now what you do is you take a measured amount of complement proteins, you take measured amount of complement proteins and antigens, and you add it to both of the solutions. तो पहले आप क्या करें, you took anti serum, you took a anti serum of patient, you took serum of patient A and patient B, and you heated it. That heating was done so that you can kill all the complement proteins and antigens that are present inside the serum, and you only let antibodies remain in patient A's uh, serum or patient A sample. Okay, so on the left, patient A has antibodies, the left right one does not have antibodies. See, you are adding complement and antigens to the serum. See, यहाँ पर क्या होता है, the complement protein which is present, that will start fixing to the antibody. ठीक है, complement attaches to the antibody and antigen will attach to the antibody. This is calculated amount. I am putting a calculated amount of complement proteins and I'm adding a calculated amount of antigens into the patient's serum. ठीक है, पेशेंट ए के सीरम में, सीरम सैंपल में देयर इज एंटीबॉडीज, पेशेंट बी के सीरम सैंपल में देयर आर नो एंटीबॉडीज. ठीक है, सो दीज कॉम्प्लीमेंट प्रोटीन्स एंड एंटीजेंस विल अटैच टू दैट एंटीबॉडी. ठीक है, दे विल फॉर्म एंटीजन एंटीबॉडी कॉम्प्लेक्सेस, कॉम्प्लीमेंट एंटीजन एंटीबॉडी कॉम्प्लेक्सेस. एंटी पेशेंट बी के सीरम में देर आर नो एंटीबॉडीज, सो दे विल बी फ्री. जो complement the complement proteins and the antigens that you have added, the calculated amount, they will remain free because there are no antibodies to attach to. See, now what you do is, now to find out whether or not that complement has fixed properly to that antibody, what you do is you take RBC, you take RBC of sheep and you add it to the sample, to both the samples. Okay, these are sheep RBCs and you add special antibodies against the RBC. ठीक है, so anti RBC antibody add कर रहे हैं आप. So I'll repeat the whole process once again. What you are doing is you are taking two samples, patient A and patient B. ठीक है, patient A के sample में you have antibodies, you have patient's complement proteins and you have patient's antigens. In patient B you do not have any antibodies, you only have complement proteins and antigen. ठीक है, you will heat both of the solutions so that the original patient's complement proteins and antigens are destroyed. All right, then you will add a fixed amount of or calculated amount of complement proteins and antigens. What will happen is these complement proteins will fix to the antibodies. जो patient A है, patient A के sample में they are antibodies, right? These complement proteins will fix to that antibody. The antigen and complement protein, both of them will fix to the antibody. Whereas in patient B, because there is no antibodies, those complement proteins and antigens that I've added, the calculated amount, they will remain free. After that, I will add a little bit of red blood cells in both of them, sheep red blood cells. Okay, and following that, I will add antibodies against the RBC. Okay, antibodies that can kill the RBC or they can attach to the RBC. Now, what will happen is, see, in patient A serum, because complements are already fixed to antibodies of the patient itself, they will not attach to the RBCs of the sheep. Okay, because your complement proteins that you have added, because they are attaching to the antibody. See, यहाँ पर क्या होता है, as soon as you add this क्या बोलते हैं RBC and you add anti-RBC antibodies, agar complement proteins are not fixed properly, they will start fixing with the anti-RBC antibody and they will dissolve or they will break down RBC, because of which the solution will turn pinkish. ठीक है, so यहाँ पर क्या होता, आप जो measured amount of complement add करें, that is attached to antibody. These anti-RBC antibodies, they will attach to RBC, and if they do not have any complement being fixed to them, they will precipitate down. ठीक है, patient A में देखो, anti-RBC antibodies attaching to the RBC, but because there is no complement protein to attach it, there will be no lysis of the RBC and it will fall down. ठीक है, it will literally precipitate down. In patient B, because complement proteins are free, what will happen is they will attach to anti-RBC antibody, and ultimately, see, antigen is going and attaching, and what will happen is these complement proteins along with anti-RBC antibodies and antigens, they will cause lysis of RBC, because of which the whole solution will turn pinkish. This is helping you know whether or not complement जो protein है, how well it is fixing to the antibody, the capability of complement to fix to antibody. Okay, see, as RBCs are lysing, the solution becomes pinkish in color. That is complement fixation test. Okay, if you have doubts, please feel free to ask. No. Okay, so those are the four main types of serological tests. Okay, now you have another one, serological test for rheumatoid factor. Okay, इसमें क्या करते हैं आप? So serological test for rheumatoid factor. Now, rheumatoid factor assessment is done for rheumatoid arthritis. Okay, whether or not the patient has rheumatoid factor will greatly uh, influence how much the degree of rheumatoid arthritis they will have, and whether or not they have rheumatoid arthritis to confirm the diagnosis and the degree of rheumatoid arthritis as well. Okay, normally what happens is you will see IgG antibodies. So you see IgG antibodies are produced during joint infection and joint inflammation. यहाँ पर rheumatoid arthritis हो रहा बोले तो, see, arthritis है मतलब inflammation of joint होएगा ही, ठीक है? Generally what happens is whenever your joints are inflamed or there is infection in the joint, you will see IgG type of antibody. All right, subsequently what happens is this IgG antibody will start acting as an antigen. Your body will think that this antibody is an antigen. All right, that is a problem, a genetic problem. Okay, यहाँ पर क्या हो रहा, this whenever there is joint inflammation, let's suppose I'm taking your knee joint, ठीक है? Let's suppose this is a patient's knee joint. Please excuse the diagram, ठीक है? Let's suppose this is the knee joint. यहाँ पर आके आपका femur आ रहा and यहाँ पर tibia and fibula. So anyway, this is the knee joint. Now whenever there is inflammation of this knee joint, so let's suppose this, it is getting inflamed, your body is producing IgG type of antibodies. Now subsequently what will happen is this IgG antibodies that is produced, it will be read as, or it will be interpreted as an antigen by your body. Okay, and because it is being read as an antigen, it will trigger another immune reaction where another antibody will be created against this antibody. यहाँ पर क्या हो रहा, IgG is acting as an antigen against whom IgM will be formed. Okay, so IgG itself will start acting as an antigen and antibodies are produced against IgG. Okay, the second type of antibody, now this is anti-antibody. Okay, this is called an anti-antibody. Okay, it is initially an antibody which is acting as an antigen. Because your body is reading it as an antigen, it is producing antibodies against the antigen, but you know that antigen is already an antibody. That is why this is called as an anti-antibody. Okay, that new type of antibody will be called IgM. This is known as rheumatoid factor. Okay, IgM which are produced against IgG, this anti-antibodies, these are called rheumatoid factors. Okay, presence of rheumatoid factors, to demonstrate this rheumatoid factors, what you do is you take serum, it is reacted with IgG. Okay, you will coat it with latex particles and you perform an agglutination test. Agar clumping hua between IgM and IgG, you know that rheumatoid factor is present. All right, normally IgG and IgM should not clump. Whenever you are performing the test, you are testing for this rheumatoid factor. Agar IgM are present which are against this IgG, agglutination reaction will occur. Okay, what you do is you take the patient's serum which has rheumatoid factor. You do not know whether it has rheumatoid factor or not, you're just taking patient serum. The patient comes to you complaining that I am having joint pain and all of that. ठीक है, inflammation in the joint, I'm having some other immunological reactions and things like that. What you do is you take a little bit of blood out of the patient and you will test that blood. अगर वो blood में anti antibodies है, IgM type of antibodies, what will happen is it will react with IgG. So you will take standard IgG, you will coat it with latex particles, and you will add a little bit of patient serum. As soon as agglutination occurs, you know that rheumatoid factor is present. अगर rheumatoid factor present नहीं होता, तो IgM would not have reacted with IgG. If rheumatoid factor is present, antibody are present, they will react with IgG. That is the serological test for rheumatoid factors. Okay. Then we have immunological tests. Now you do not have the details of immunological tests. You only have a few types of immunological tests, name wise given into you for you in your portion. So I will name a few of those important ones. Immunological tests. Okay. Now immunological tests are two main types. First one is agglutination tests. Second one will be precipitation tests. Okay. Now agglutination tests may you have 5 different types. So first of all, agglutination tests, 5 different types. First type will be bacterial agglutination. Okay. It can be a specific test like Vidal test, okay, to find out a typhoid. In that you do direct specific type of bacterial agglutination test, या फिर non specific भी रह सकता. For typhus fever there is something called Weil Felix test which is done for typhus fever, that will be non specific. So both of them will be bacterial agglutination. You are trying to find out that bacterial antigens whether or not they are present in a patient's body, okay, by agglutinating those antigens. Then you have red cell agglutination. Now red cell agglutination में भी direct indirect रहता. डायरेक्ट एग्लूटिनेशन हेमा एग्लूटिनेशन बोलते हैं उसको. डायरेक्ट रेड ब्लड सेल एग्लूटिनेशन का एग्जांपल इज ब्लड ग्रुपिंग. whenever you're trying to find out the blood group, I told you whenever you are adding anti A to blood type A or anti B antibody to blood type B, there will be agglutination reaction that is helping direct way through which it is helping in blood grouping. या फिर यू फॉर दिस थिंग कूम्स टेस्ट अगर आप रीसस फैक्टर के लिए कर रहे हैं, दैट विल बी इनडायरेक्ट टेस्ट. ठीक है, इफ यू रिमेंबर कूम्स टेस्ट में यू आर ट्राइंग टू टेस्ट फॉर RH एंटीबॉडी. ठीक है, वेदर और नॉट द पेशेंट इज RH पॉजिटिव और RH नेगेटिव, वो देखने के लिए you will perform Coombs test. All right, that is an indirect form of hemagglutination. All right, then we have third type, leukocyte agglutination tests. ठीक है, मेनली दिस इज डन फॉर आइडेंटिफिकेशन ऑफ HLA. ठीक है, HLA टाइपिंग आप कंपैटिबिलिटी चेक करने के लिए करते हैं. फोर्थ मेनली ट्रांसप्लांट्स एंड ऑल उसमें काम आता. ओके, देन वी हैव प्लेटलेट एग्लूटिनेशन टेस्ट. ठीक है, दिस इज टू डेमोन्स्ट्रेट एंटीप्लेटलेट एंटीबॉडी. Then the last one will be latex agglutination test. ठीक है, इसको लेटेक्स फिक्सेशन टेस्ट भी बोलते हैं. यू कैन परफॉर्म अ लेटेक्स फिक्सेशन और agglutination टेस्ट फॉर rheumatoid arthritis. You can perform a progestin test for this. You can perform a human chorionic gonadotropin test with this. ठीक है, human gonadotropin chorionic gonadotropin is generally present, indicative of pregnancy. ठीक है, उसमें काम आता है ये पूरे टेस्ट. Then you have precipitation tests. Okay, precipitation tests में 4 main types है. You have first type which is gel diffusion tests. ठीक है, gel diffusion tests में 4-5 टाइम रहते हैं. You have single gel diffusion in single dimension, in double dimension, double diffusion in one direction, double diffusion in 2 directions. अलग अलग टाइप है, ठीक है। यू विल हैव इम्यूनोइलेक्ट्रोफोरेसिस स्पेसिफिकली फॉर डिटेक्शन ऑफ आईजीजी एंटीबॉडीज, मोनोक्लोनल गैमोपैथी, ऑल ऑफ दैट, ठीक है। फॉर मल्टीपल मायोमा, ऑल ऑफ दैट, उसमें जेल डिफ्यूजन टेस्ट यूज करते हैं। देन यू हैव कॉम्प्लीमेंट फिक्सेशन टेस्ट। प्लीज बी केयरफुल, दिस इज नॉट कॉम्प्लीमेंट, दिस इज कॉम्प्लीमेंट, okay? Now complement fixation test आप यूज कर सकते हैं syphilis के लिए। There's something called Wassermann reaction. Wassermann reaction is done for syphilis diagnosis. You can perform it for identification of parasitic antigens. If the patient is suffering from a parasitic infection, उसमें काम आता। Then we have test tube or capillary tube method. Test tube or capillary tube method, ठीक है। नाउ दिस इज डन फॉर सिफिलिस के लिए यूज कर सकते हैं आप, स्ट्रेप्टोकोकल ग्रुपिंग के लिए कर सकते हैं, और यू कैन डू इट फॉर लीशमेनियासिस, कालाजर, यू कैन डू इट फॉर डायग्नोसिस ऑफ हाइड्रेटेड सिस्ट्स, ठीक है। हेलमिंथियासिस जो है, अलग अलग टाइप ऑफ हेलमिंथ्स जो रहते हैं उसके लिए कर सकते हैं। एंड लास्टली द फोर्थ टाइप, टेस्ट फॉर हाइपर सेंसिटिविटी, टेस्ट फॉर हाइपर सेंसिटिविटी। ना हाइपर सेंसिटिविटी अलग अलग डिजीजेस में आती। फॉर एग्जांपल वन ऑफ द मोस्ट कॉमन वंस इज मॉन्टॉक्स टेस्ट। मॉन्टॉक्स टेस्ट इज डन इन टीबी, ठीक है। दैट इज अ रिएक्शन फॉर हाइपर सेंसिटिविटी। और लेप्रोमिन टेस्ट लेप्रेसी के लिए, या फिर टॉक्सोप्लाज्मिन टेस्ट, टॉक्सोप्लास्मोसिस, ठीक है। ब्लास्टोमाइसिन टेस्ट, ब्लास्टोमाइकोसिस, या हिस्टोप्लाज्मिन टेस्ट, हिस्टोप्लास्मोसिस, ठीक है। All of these are testing for hypersensitivity in a patient when you are giving an antigen in the patient, ठीक है। If that disease is present, the patient will have a hypersensitivity reaction where a small allergic kind of reaction will appear in the patient's skin, ठीक है। That is how you test for other diseases, whether or not they are present in a patient. So these are different types of agglutination and precipitation tests. You don't need to go into a lot of detail about them. You do not have a lot of detail about them anyway. So just the types are enough. All right. We'll discuss about ESR tomorrow. You have a few other blood tests. I'll start off with ESR, and we'll try to complete ESR and see what happens after that. Bone marrow aspiration and all of that is there.